Hello, good morning, good afternoon, good evening to wherever you are joining us from around the world. And welcome to today's Biogal webinar, Feline Vaccinations from Kittens to Senior Cats, Tricks and Hoaxes. It's a great title for this spooky season. It's great to have you all logging in and taking part, and I hope that you are looking forward to learning more about today's topic from Dr. Paolo Dallara. Today is being hosted by Biogal Labs. Biogal is a manufacturer of veterinary diagnostic tools. They have developed many small animal infectious disease detection product lines, all of which can be performed and analyzed from the comfort of the vet's own practice or lab. They supply their products to more than 50 countries from around the world and support their partners with educational tools and the latest veterinary updates. You can learn more about Biogal at biogal.com. My name is Jessica Case, and I am the manager of Complete Veterinary Care. We are proud to be the UK distributors for Biogal Labs. You can contact us at info@cvcgroup.co.uk. While you are all logging in and settling in, I'd like to let all of our Turkish, Spanish, Portuguese, and Italian speakers know that we have live translation for today's webinar. You can find the options in the Zoom menu. I believe it's called interpretation. If you click on that, you'll see the option for your language. So we have Turkish, Spanish, Portuguese, and Italian live translation for today's webinar. So please do join in with that if that is your preference. I also need to ask you to please type all questions today about the topic in the Q&A box of your Zoom menu. You should be able to see a Q&A section. If you put all your questions into that section, they will be recorded and we will present them to Dr. Dallara at the end of today's webinar. Don't worry if your question isn't answered live today. They will all be recorded and presented to her later on. She will write the answers for the questions and these will be sent to you along with the certificate of attendance for today's session. So please put all questions in the Q&A box rather than the chat because they're more accurately recorded in the Q&A box. Dr. Paolo Dallara is a tenured associate professor in the Department of Veterinary Medicine and Animal Sciences at the University of Milan. Her main field of study is in applied immunology and pet vaccinations. Dr. Dallara is the author of the 3rd edition of the immunology section of the textbook Veterinary Microbiology and Immunology, and the book Vaccines and Vaccinations of Companion Animals, as well as more than 200 scientific papers and articles. She has contributed to more than 110 congresses, had more than 100 invitations as a speaker for lectures, and has tutored more than 330 degree theses in veterinary medicine. In today's webinar, Dr. Dallara will be discussing the tricks and hoaxes around feline vaccinations. Her presentation will include information about kittens' immune systems and the double-edged weapons of maternally derived antibodies. She will discuss how and when to start vaccinating kittens to avoid dangerous vaccination failures. She will discuss how not all cats are the same and neither are vaccinations. She will talk about when and where to vaccinate adult cats to guarantee the best protection whilst limiting the risk of side effects. And lastly, for senior cats, Dr. Dallara will discuss if it is better to continue vaccinating or to stop vaccinations. So before I introduce Dr. Dallara, one more reminder to please put all of your questions into the Q&A section of the Zoom menu rather than in the chat box, as they will be recorded to be presented to her later on. And with that, it's my pleasure to introduce Dr. Dallara. Thank you, Dr. Dallara. We look forward to hearing from you.
Thank you, Jessica, for your beautiful presentation. I will share my screen. Okay. You can see my screen. Okay, just a moment. Okay. And we can start. So good afternoon, everybody. And this is the topic of my presentation today, First of all, I apologize for my less than fluent English, but I promise I will try to do my best. Before starting, let me introduce myself. And this is me. And now I can start talking about tricks and hoaxes of feline vaccination. And the main characters of my presentation today will be my red cat Linus and some other red cats. Starting with the feline vaccination, we have to consider many factors. First of all, the owners, then the cat, then the vaccine, and finally the vaccination. Let's start with the owner. There are many market surveys that underline that owner wants to get involved with the vet and wants to establish an empathic relationship with the vet. But how vet can communicate correctly information with owners? First of all, vets have to provide a complete, updated, and scientifically correct information. Never minimize, for example, the side effects of vaccination, and always say the truth. Times and contents must be adapted every time to the owner's cognitive and emotional needs, because not all the owners are the same. There are some owners more emotional, and there are some other owners that need more technical information. Then communication must be coherent and structured in order to correctly orient the owner's decision, because the decision to vaccinate is an owner decision, but you can orient owner, above all owners that have some doubts about vaccination. But why I put here these characters of the movie Madagascar?
I like to move it, move it. I like to move it, move it. Yeah, I like to move it. I like to move it, move it. I like to move it, move it. I like to move it, move it. Yeah, I like to move it.
Because also the posture and the body language are very important. When you are speaking with an owner, you can't look at a computer, for example, or you can't look at your smartphone. You have to look into the eyes, the owners, because owners need your attention. In addition to the publication of the famous guidelines for vets published by many international associations, the same association, in my opinion, intelligently decided to publish similar guidelines for owners and breeders, similar but simplified, easier to understand. In this slide, there are the main owners guidelines. For example, the SABA guidelines, the American Association of Feline Practitioners, the American Animal Hospital Association, the British Small Animal Veterinary Association, the Australian Vet, and the UK Veterinary Medicine Directorate. This is an example of guidelines for owners. This example is of the World Small Animal Veterinary Association. These are guidelines for owner, but as you can see here, the structure is the same of the veterinary guidelines, only more simplified. This is another example, and this is an example of guidelines for cats, for vaccination for cats, published by the American Association of Feline Practitioners. As you can see here, there are many figures, there are some images, because it's more simply to understand the concept of vaccination. Let's start speaking about the cat. Cats are not all the same. They are different, for example, for age, for sex and reproductive status, or for lifestyles. So, vaccination must be tailored for each single cat based on these particular characteristics. And vaccination is impossible, it is not correct to vaccinate out of habit. Cats are not all the same, for example, for age. In this slide, we see my cat Linus growing during time. And this is not all the same during time. The basket is always the same. And in effect, after years, it is a little bit ruined. In 2021, the American Animal Hospital Association, together with the American Association of Feline Practitioners, published the new feline life stage guidelines. These guidelines divided cats into 4 classes of ages. The kitten from birth up to 1 year, young adult from 1 to 6 years, mature adult from 7 to 10 years, and senior more than 10 years. In this last category, there are also the geriatric cats, the older cats. In this table, we can see a comparison between the feline age and the human age. For example, my cat Linus is 14 years old, that represent a man of more or less 70 years. And this table is approved by both associations. I am an immunologist, and I know that in kittens, immunity doesn't work very well. In fact, up to 30% of live-born pets die before reaching 3 weeks of age, and 70% of these die in the first week, and in the first 3 days of life, mainly for septicemia. But why? Because kittens can fail to mount an effective immune response when they encounter an antigen, because this is the first time they encounter an unknown antigen. So they can mount only a primary immune response. This kind of response is a low response. Antibodies are slow to appear. The antibody titers are low, and the famous duration of immunity, the DOI, is limited. And sometimes antibodies can even totally disappear. But in the meantime, immune system works and many memory cells are produced. So over the time, immune system works and memory cells proliferate. And when the kitten encounter for the second time, the third time, the fourth time, the same antigen the kitten knows, the kitten can mount a secondary immune response. This kind of response is called also anamnestic response, because in this kind of response, very important is the memory, the immunity memory, and the immune system remember the antigen the kitten encountered before. So in this case, the response is much more faster. The antibody titers are much more higher, and the DOI is much more longer. It can last months or even years. This is the same concept graphically reported. On the left, there is the primary response. In this response, there is a low production of antibodies, and these antibodies are IgM. IgM are the typical antibodies produced when an organism encounters for the first time an antigen. This response is not long-lasting and can also disappear. When the organism encounters for the second time the same antigen, the immune system mounts a secondary immune response, this time producing IgG. IgG are the memory antibodies. This kind of response is very high and higher than the primary one, and faster and long-lasting. In the kitten, there is also another problem, because cats have an endothelial-chorial placentation. This kind of placentation is a barrier, and this barrier is relatively impenetrable to the in utero antibody transfer. In fact, only a small IgG amount pass through this barrier, and kittens have a very low systemic immunity. The really transfer of passive immunity begins postpartum via colostrum. But colostrum has a great variability in its immunity, and its variability is among queens, but also among mammary glands of the same queen. Colostrum surely is fundamental for the kitten's survival, because it ensures both nutrient and immunity provision. And the antibody transferred with colostrum are the famous maternally derived antibodies, the so-called MDA. Sorry, I have a dog that barks. These antibodies are very important for the survival of the kitten, but they have a dark side. In fact, the MDA transfer is considered a double-edged weapon. In fact, on one hand, it helps in reducing neonatal mortality and in increasing survival rate. But on the other hand, it can interfere with kitten vaccination. This interference is variable and depending on many factors, and later we will see these factors. But this interference is considered the main reason of vaccine failure that is typical of this particular class of age. Speaking about MDA, the questions are many and are very difficult to answer. How many MDA pass to newborns? How long MDA lasts? And how long MDA interfere with vaccination? All depends on antibody half-life in the offspring. And this half-life depends on many factors. For example, how many antibodies has the mother? How many antibodies the mother transfer into colostrum? How many colostrum is intaked from the kitten? How many colostral antibodies are absorbed into the gut? There are some individual differences, above all in dogs. For example, in dogs there are genetic differences and there are the low responder or non-responder subject. And also in the dog, there are some big differences in breed size. In the dog, there are toy, there are small size, small breed, medium, large breed. The cats are very similar. There is no a big difference between cats. Another effect very important for the interference is the vaccine immunogenicity, but there is another factor very important, the MDA specificity. This specificity depends on the pathogen. In fact, if we consider, for example, antibody against herpes virus, these antibodies, these MDA, have an half-life of 8 days. That means that every 8 days, the quantity halves. And this means also that the duration of protection is of 8 to 12 weeks. But if we consider other viruses, for example, Paleocopenia virus, that is a parvovirus, or calicivirus, in this case, the half-life of MDA is longer, about 10 days. And longer is also the protection, 10 to 14 days. So the protection is longer, but also interference is longer. Starting from 8 to 12 weeks of age, MDA begin their decline, but this decline is very, very slow. Of this aspect, you have to consider when you consider the correct protocol for a kitten. But you have also to consider another important class of age, the older cats. In fact, also in the elderly, the immune system doesn't work so well. All districts of the organism suffer from the aging process, and the immune system suffers too. There is a decline in immune defenses, and above all, the cell-mediated immunity, that is the stronger immunity. The consequence is a non-perfect response to vaccination, but the difficulties in fight an infection is only towards new antigen because the memory cells continue to work, and the immune memory continue to work. And also of this aspect, you have to take in consideration this aspect when you think about vaccination of an old cat. Cats are not the same also for the sex and the reproductive status. In fact, there are intact cats or neutered cats. But speaking about immunity and vaccination, the most important aspect is pregnancy. In fact, a classical question is, does a pregnant cat need to be vaccinated? In my opinion, vaccination of a pregnant female, in this case queen, but also a bitch, would be avoided in order to avoid potential risk to fetus. I always say that you have the entire life of a cat or of a dog. You don't have to vaccinate in pregnancy. You can begin before pregnancy, or you can vaccinate later after weaning, for example, but not in these 2 months. If it's not possible to wait, for example, there is an outbreak of parleukopenia, or the cat needs to move abroad, and in this case, the rabies vaccination is mandatory, you have to use only vaccines registered for this period. But you have to carefully read the vaccine leaflet, because not in all countries vaccines are registered for this period. For example, in Italy, there are no vaccines available for pregnant queens, apart some vaccines against rabies. But for example, trivalent vaccines are not available for this period. Cats are not the same also for their lifestyles. There are cats that live indoor, there are cats that live outdoor, or the cats that live both indoor, outdoor, like for example Linus, that can decide if to go outside or to remain inside. But this lifestyle is very important in order to evaluate the risk of infectious disease. There are cats at low risk that are cats that live indoor, generally are solitary cats, never go out, never go on a boarding cattery, and never travel. But there are also cats at high risk. This is the case, for example, of multi-cat household, cats that go out, that live outdoor, or that have a life indoor-outdoor, or also a cat that live indoor, but with a cat that go outside. Other cats that often go on a boarding cattery or that sometimes travel. These two categories are completely different for the needs of vaccination. Let's speak about vaccines. Also, vaccines are not all the same, and vaccines can be divided into big categories: the non-infectious vaccines and the infectious one. The non-infectious vaccines are vaccines that, when administered, don't replicate. There are many types of non-infectious vaccines, but non-infectious vaccine marketed for cats are only 2 types. the killed vaccines, the classical inactivated vaccines, and the subunit vaccines that can be produced synthetically or by recombinant engineering. These kind of vaccines represent exogenous antigen. For example, if the vaccine is a viral vaccine, the virus can't enter into the cell, can't infect the cell. So in this case, these kind of vaccines can stimulate only an humoral immunity, the production of antibodies. The infectious vaccines, on the contrary, when administered, replicate in the organism. And this is the case of the modified live vaccines, the so-called MLV, that are attenuated pathogens, and of the vectored vaccines. In this case, a microorganism acts as vector, and inside you put a gene coding for a particular protein, and you use this vector and you administer this vector, so the immune system produces antibodies against this protein. This kind of vaccines represent, in this case, endogenous vaccines. If the vaccine is a viral vaccine, the virus can enter into the cell this time and can infect the cell. So, apart the humoral immunity, this vaccine can stimulate also a very good cell-mediated immunity. In the non-infectious vaccines, sometimes there are some adjuvant inside, and the adjuvant can help vaccine in stimulating also the other immunity, the cell-mediated immunity. But not all vaccines are for all animals. In fact, vaccine can be divided in 4 categories. There are the so-called core vaccines that are the recommended vaccines. These are for contagious, widespread, and life-threatening diseases. There are the non-core vaccines that are optional. These vaccines are not less important than core vaccines, but are recommended only in case of a real risk of exposure. And this risk is based on the lifestyles of the animals and on epidemiological risks. There are also the so-called circumstantial vaccines. In this case, these are non-core vaccines promoted to core for a real risk of exposure. An example of circumstantial vaccines are vaccines against rabies, vaccines that can be mandatory for the movement, international movement of animals, or in case of an outbreak of rabies. In Italy, we consider circumstantial, that means core vaccines, also vaccines against leptospirosis for the dogs, and vaccines against FeLV, feline leukemia virus, for the cats. Finally, there is another category. This is the category of the not recommended vaccines. In this case, these vaccines are not dangerous, but there is a little evidence of benefits. That means that vaccinate or not vaccinate is the same. How can classify the dog and the cat vaccines? We can classify them into the 4 categories: core, circumstantial, non-core, and not recommended. But today we are interested only in cat vaccines. So we consider only the cat vaccines. The core vaccines for cats are against paleocopenia, herpes virus, and calicivirus. These are really recommended for all cats. Circumstantial vaccines are rabies and feline leukemia. Non-core vaccines are all the others, but not all are available in each country. For example, in Italy, we have only the Chlamydophila felis vaccine and the dermatophytosis vaccines. And there is only one not recommended vaccine against feline infectious peritonitis. Speaking about vaccination, sorry, let's start with the definition of vaccination. Vaccination is classically the introduction into humans or animals of a whole microorganism, parts of them or their products, previously treated to make them harmless for the purpose of inducing the development of immunity and protecting them against infectious diseases. This is a classical definition. Fundamental is to start the vaccination as soon as possible. So starting from puppies and kittens. And today our goals are kittens. But there is no a single definition of vaccination. Vaccination is also a trick to mislead the immune system, making it believe it has to fight an infection. And the more the vaccine will be similar to the true offender and, like the field pathogen, will activate the immune defenses, the more the trick will work. Consequently, also protection is not always the same, because non-infectious vaccines can stimulate a non-complete immune response, and consequently, generally, they need annual boosters. I have to say generally, because there are some exceptions. For example, the rabies vaccines. Rabies vaccines have a DOI, a duration of immunity, of 1 year, 2 years, or 3 years, based on the vaccine you choose. The infectious vaccines, on the contrary, stimulate a complete immune response. So after the first vaccination series of the kittens, protection is much more longer than 1 year. And if you remember the concept of the trick, the non-infectious vaccines are vaccines that don't work very well as trick. On the contrary, infectious vaccines are a good trick because they stimulate the immune response in the immune system like the field pathogen. Vaccination is still important today because it is the most successful health measure we have, both in medical medicine, yes, human medicine, and in veterinary medicine. The vaccination play a very important role in control of many dangerous diseases, and vaccination permit the eradication of smallpox in human medicine and of rinderpest in veterinary medicine, and almost eradicate poliomyelitis and many other diseases, both in human and in medical and in veterinary medicine. Now, vaccination is the safest health measure we have. In fact, the incidence of side effect is very, very low. This is a sentence of the American Association of Feline Practitioners Feline Vaccination Advisory Panel Report of 2013. And they say that currently available feline vaccines have an excellent safety record in 2013. Now it's even better. Vets can use the vaccination guidelines published by many different international associations. The most famous are the SAVA, World Small Animal Veterinary Association, but there are also the International Society of Feline Medicine for cats, the American Association of Feline Practitioners for cats, and in Europe, the Advisory Board on Cat Diseases, and many others. They are different, but all these associations and all these international guidelines agree with the concept of the correct vaccination. Starting with kittens, we know that most kittens are protected by MDA in their first weeks of life. So, ideally, first vaccination would be administered when these MDA are about to end. But this prediction is very difficult to do. In fact, there are kittens with poor MDA that can be vulnerable and able to respond to vaccination at an earlier age. But there are also kittens with high MDA, and this kitten may be protected and unable to respond to vaccination until 12 weeks of age or more. So, as you can see, every kitten is different from another, and every kitten has its own history. So it's impossible to propose an only unique protocol, and no single primary vaccination policy will cover all possible situations. So all the international guidelines agree with the advice to administer multiple core vaccine doses only using modified live vaccines, starting from 6 to 8 weeks of age, 3-4 weeks apart, until 16 weeks or older. This is an example of a vaccination protocol for a kitten. You can start at 8 weeks of age with the trivalent Paleocopenia, herpes virus, and calicivirus infection, and repeat vaccination 3-4 weeks apart, adding in the second injection also FELV, but of this we can speak later. Or you can start at 9 weeks of age. It is advisable to follow the suggestion of the entire scientific community and to foresee at least 3 vaccinations up to 16 weeks of age. The recommendation is not to stop before. If you stop vaccination at 12 weeks of age, you have no guarantee of protection. Stopping at 12 weeks of age is an hoax, because you have no guarantee and you risk the vaccine failure. In this case, these multiple vaccinations are revaccination and are not booster, because you are using MLV vaccine that are live vaccine, and MLV vaccines recall themselves. Only in case of emergency, for example, an outbreak of Paleocopenia, it is possible to anticipate the start of vaccination at 6 or 7 weeks of age. But pay attention, because not in all countries are available vaccine for kittens less than 8 weeks of age. For example, in Italy, we have no vaccines for this class of age. So you can, in case of emergency, you can use vaccines before, never before 4 weeks of age, but at 6 or 7 weeks of age, okay, but this is an off-label use. You have the whole responsibility for this. And these are examples of a vaccine protocol for adult cats. You have to remember that adult cats can be at 0 risk or low risk or of high risk. So if you have to vaccinate a 0 risk cat, you can vaccinate every 3 or 4 weeks, and you can stop vaccination against FELV. If you have to vaccinate a low-risk cat, you can vaccinate every 2 years, for example. And if the cat is a high risk, you can vaccinate every year, but not for panleukopenia, because panleukopenia is a parvovirus infection. Parvovirus is a good immunogenic, and in this case, panleukopenia doesn't need recall like herpes virus or caribou virus. So for these two respiratory virus, you can foresee annual or every 2 years vaccination. For panleukopenia, every 3 or 4 years. Remember that vaccination 1 year later, the vaccination of kitten is considered the closure of the first vaccinal series. It is possible to control protection after vaccination. Yes, it is possible. It is important, but it is possible only for core vaccine, both in dogs and in cats. This is important, but not only important. For me, is essential for the good vaccination practices. In 2016, the FSAVA guidelines suggest the serological testing and suggest to use in-clinic test. I have started 2 years before, in 2014, controlling specific antibody response in dogs and cats with VacciCheck. VacciCheck is an in-clinic test, is an ELISA test produced by the Israeli company Biogal and marketed exclusively in Italy by AgroLabo. Thanks to Biogal and AgroLabo, to date, after 8 years, I test about 1,200 dogs and 360 cats. I continue to test dogs and cats, and I have many very interesting results because I test animals in different situations. Speaking about FELV, in 2020, the American Association of Feline Practitioners published the guidelines for retrovirus management. And these guidelines suggest to vaccinate all cats at risk, but only seronegative cats. In this case, you have to start with kittens because you don't know what the life of cats, the future life of these cats. So you have to protect the kittens, and you have to vaccinate seronegative cats. And a classical hoax is to wait 6 months in order to test cats for FELV. But this is an hoax, because when you test cats for FELV, you look for antigen, and you can use this test when you want. You can use this test in kitten. So you have to test kitten, and only seronegative kitten have vaccinate. Then after 1 year after the vaccination, the first vaccination, cat receive a booster vaccination. And then you have to decide if continue to vaccinate or not, based on the risk of a single cat. In case of the no risk of exposure, and here are some examples of no risk reported in these guidelines, you stop vaccinated against FELV. In case of low risk of exposure, you can vaccinate every 2 years. And in case of high risk of exposure, you can vaccinate annually. Remember also that in some countries, like Italy, there are vaccines registered for and use every 3 years. And this is very easy and is an optimum when you have to vaccinate cat at risk. When you have to vaccinate a senior cat like Linus, you have to remember that in the elderly, there is a difficulty in fighting only a new antigen in mount a primary response. But the memory cells and the immunity, the memory of the immune system work and remember known antigens. So the secondary immune response works well. So in the elderly, don't stop vaccination, but modulate them as you do in adult cats. This is the last argument, the correlation between vaccination and feline injection site sarcoma. This sarcoma is largely caused by vaccines, even if other materials have been implicated, for example, transponders or suture wires. The habit to vaccinate into the interscapular space is no longer recommended, because if FIS develops here, it's very difficult to surgically remove it completely. Recommended are other zone of the organism, for example, the distal limb, because in case of FIS, the amputation is facilitated. Also, the ventral abdominal injection here is recommended. In this case, in case of FIS, the aggressive tissue removal is needed. And someone propose also the distal tail injection. And in this case, if FIS develop here, the amputation is better than the amputation of limb. But I don't know how easy it is to inject this particular site of the tail. So after my presentation, the take-home message is this one. Keep calm and vaccinate cats.
Oi, entra. Acabamos de acabar aqui a palestra de vacinação. E aí, fez tudo?
And now I'm here for you for
Toma
questions.
aguinha, peraí, deixa só.
Thank you so much, Dr. Zlara. That was really, really interesting and very helpful. Thank you.
Thank you, very welcome.
So we do have a couple of questions which I'll present to you now. The first one is, herpes is transferred from many queens to their kittens through their milk. Does that mean that FH1 vaccinations should be given earlier than other kitten vaccinations?
Okay. As I say before, every kitten is different from another. The essential is the administration and the administration of colostrum in the first day, because in the first day the gut permit the absorption. The milk of the second, third, or fourth day contained a high titer of antibodies, but these antibodies can't be absorbed into the gut. So the very important things is the first day. And if you know that a kitten intake a good quantity of colostrum, you can imagine that the transfer was okay.
Great, thank you very much. The second question is, can you use intranasal rhino/Kalichi vaccine as a treatment for upper respiratory infection?
I know that someone use the intranasal administration also not only for herpes virus and calicivirus infection, but in some cases also for paleocopenia infection. I don't have a personal experience of this, but I know that some colleagues do this practice.
Okay. The third question is, when should the queen be vaccinated after giving birth?
After weaning, because you have to read carefully the leaflet and control if a vaccine can be used not only in the pregnancy, but only in the lactation. And many are not permitted in the lactation. So you have to permit the weaning, the finish of the weaning, and then you can vaccinate. But generally, you vaccinate before pregnancy and not after pregnancy. But if you vaccinate correctly a kitten and an adult, you have you don't need to repeat vaccination close to pregnancy, because the immunity is a very good immunity.
Okay, thank you. Question 4 has 2 parts. Is it recommended to vaccinate an FIP positive cat? And why are FIP vaccines not recommended, even though it is such a deadly disease?
Okay, I start with the second part. The FIP vaccine is not recommended because it can be used only starting from 16 weeks in only seronegative cats for coronavirus. But it is quite impossible that a cat is negative at this age. And there are some advantage to use this kind of vaccine. And all international guidelines consider not recommend this kind of vaccine. This kind of vaccine is an intranasal vaccine present in some countries, not all over the world. In Italy, for example, there is no this kind of vaccine. The other question is if it's possible to vaccinate a FIP positive cat, but against other disease, I think. For example, for the trivalent.
I assume so, yes.
You have to consider very well every patient because you have to consider the risk that this cat has and the real need to vaccinate it or not, because this is a not healthy cat. But in some cases, not healthy cat can be vaccinated if the disease is stable. For example, is in equilibrium. For example, the diabetes. A diabetic cat can be vaccinated if the diabetes is under control. But in this case, this is an infectious disease. So you have to consider very well the opportunity to vaccinate a FIP positive cat or not.
Mm-hmm. Okay. What would be the most appropriate vaccination protocol for a kitten shelter?
Kitten shelter has a higher risk of disease, but you have to consider if there is a risk in this moment or there is only the environment that could be at risk. So you can start, I think, at 6-7 weeks of age, like or other kittens. And in case of disease, for example, leukopenia, the international guidelines suggest in kittens, but also in adults, to repeat vaccination, not 3-4 weeks apart, but every 2-3 weeks, because this is an emergency situation.
Okay, that's really helpful. Thank you. And then lastly, there was a case study that somebody would like your opinion on. They said, for the first time in 30 years, I had 2 lethal adverse reactions in 2 kittens, about 3 months old. One was Blue Russian and the other an adopted European stray. Both were in good clinical condition, checked for parasites, etc., with panleukopenia, herpes, and calici. Both with pneumonia, with no post-mortem examination. Both vaccinations came from the same vaccine box. The manufacturer, after the alert, at the moment claims there is no relationship. What is your opinion?
Also, in this case, all case is different from another. You have to consider when you have an adverse reaction after vaccination that there is a time relationship between vaccination and the adverse effect. But you have also to consider there are many factors that can influence the reaction. For example, there are some cases that mimic an adverse reaction and anaphylactic reaction, but there are no where the immune system doesn't work. For example, this is the case a collapsus after vaccination. In this case, you are in vasovagal syndrome, and the cat or the dog has the same symptom like an anaphylactic reaction. You have to, in this case of this cat, you have to control with the post-mortem exams if there are signs of anaphylactic reaction or allergic reaction or not. The response to an antigen is an individual response, and perhaps with the same vaccine, not all animals respond in the same way. So it's very difficult, and only case must be studied in detail.
Very interesting. Well, thank you so much for your time, Dr. Lara, for your presentation. It was very, very helpful and very, very interesting. We had a lot of participation, and we really appreciate your time and your expertise. Thank you also to Biogal for hosting today's webinar. Thank you to everybody that took part. It's been great to see you all sending in your questions and saying hello from all over the world. For more information, please do contact Biogal Labs via their website at biogal.com. Their experts would gladly assist you with any questions that you have about today or any of their products. For UK listeners, you can contact CBC at info@cbcgroup.co.uk. There will be attendance certificates sent out to everybody in a few days' time, along with all of the questions that were answered today and any others that were sent in that we weren't able to get to today. Biogal do offer a free 12-lesson course on feline coronavirus and FIP diagnosis and prevention to assist you in learning about these diseases, their diagnosis and treatments. There is a test at the end with a certificate of completion for those that pass. We look forward to inviting you to any future webinars. Please keep an eye out for those. They will be coming soon. Thank you again for taking part today, and we will see you again soon.
For my part, thank you very much to Biogal for inviting me, and thanks to all audience. Thank you very much.
Thank you. Bye.